everybody. Welcome to this week's episode of Tell Me More, Better Conversations in Healthcare. I am talking to patients who have had really bad conversations in the course of their healthcare journeys with the singular focus of trying to teach people how to have better ones on both sides, patients and healthcare workers, professionals like myself. So I've had the opportunity to talk to many people in the life of this podcast, and every story is different. Every story teaches me something. But my guest today has such a unique story and such a motivational outcome, if you will, that I'm just super excited to have her. Liz, welcome to the show.
Thank you for having me.
It's my pleasure. So we're going to have this conversation today about lots of things, but to just give people background, you have survived 5 different cancer diagnoses, right?
Yes,
you've had
5.
2 skin cancers, 2 breast cancers, and a thyroid cancer.
Correct.
Right? Oh my God. I say that and I feel like I'm ordering off of like a takeout menu. Dude, what? Like that just does not seem like numbers.
I would not recommend this restaurant, FYI.
No. God. So just tell me about that. You know, how old were you when you first got your first diagnosis and that journey?
It's so funny. I imagine a lot of parents on the listening in will understand. I age everything by the age of my children, right?
Oh,
and so
yes.
My daughter and son were toddlers. They were babies when I had my first breast cancer. My first cancer, my melanoma. My son was 1 and my daughter was 3, and it was only caught because my mom was being such a nag. We were at the pool and my baby, my 1-year-old son, was having a nap on me, and I was in this really contorted position trying to kind of like hold him so that he wouldn't slip and fall off because we were both all sweaty. But like, when it's your last kid and I better enjoy this nap because it's going to go away soon.
Yeah.
And my mom noticed this mole on my upper thigh, and I don't know that like that part of my thigh would have been so in her face had I not been this like really weird contorted position. And she didn't like the look of it and kept saying, go to the dermatologist. And I blew her off, like, because that's what we do.
Daughters do.
30s,
yep.
Right. Yep. And eventually she nagged me enough that just to get her to shut up already, I went to the dermatologist, and it turns out that was melanoma.
Wow.
And the dermatologist called on, I remember it was like the Tuesday after 4th of July weekend. She said, okay, we got your biopsy back and that mole is melanoma. It's too large for Mohs surgery. We're going to make an appointment for you with a surgeon. I don't care when it is and what's on your calendar. You need to go to that appointment. And it was very chilling. Like it was one of those, your life is now going to be on hold. Yeah. And so between Tuesday and being diagnosed on Tuesday, I had surgery Friday. Like that's how fast that went.
Wow.
And it was my first cancer, so I didn't know anything. From my point of view, that was how all cancers were supposed to go. And it was crazy. Basically, as I understood it, had the cancer spread, I would have less than a year to live. And if it didn't spread, no big deal, wear more sunscreen. Like,
oh, wow.
That's
right.
That's a whiplash, right? Like that's a
right.
lot.
So, all right. I want to talk about that conversation, that first conversation, because you've never had someone call you and tell you had cancer. So you had the biopsy. How long did it take from when you had the biopsy to when you got the call with the results?
It was a long weekend. I want to say that the biopsy was the prior Friday, and then it was like a 4th of July holiday weekend. So it was, I don't remember exactly where it was, but then that Tuesday was when I got the call. And I honestly I just wasn't worried about it. It was a mole. I have freckles. Like I did not spend time that particular weekend agonizing over that biopsy. I kind of forgot about it, other than it was annoying that I couldn't go swimming because I had a hole in my leg, right? Like that was it.
Right.
Like, I don't know. I'm more focused on like the fireworks plans and, all of that
the
stuff.
Kids.
Like, yeah.
Right. So, So that's a very important piece, right? Because, a lot of times in these stories, the frustration begins with this delay. Like you
Yes.
have something done and then you are like agonizing over the results and it takes forever to get the call, right? But that's not the issue here. You get a call. Was it
No.
the doctor that did the biopsy herself that called you?
Yes. And again, I'm so dumb. I don't know any better. I don't know that that's bad. When the doctor picks up the phone, oh
Yes.
crap, this is not good news, right?
Yes.
So,
Yes.
yeah. But to
So
be fair,
how?
the surgeon who did the surgery, to do the removal and also the lymph node biopsy, in my groin, which by the way, 0 out of 10, do not recommend.
Oh my
Um,
God.
that sucked. Um, she said, and to her credit, that Friday had the surgery. She said, I will call you at 2 o'clock on Monday with these results. So we knew when that call was coming. There was no so my husband was like sitting around, we were just sitting around looking at the phone at exactly 2 o'clock. She called, it was all clear. We had a big
Oh,
celebration. It was fine. So, then I went online and spent $8 million on what is it? The sunscreen shirts and and sunscreens and hats and, you know, long sleeve swimwear for my children. And I mean, I just became like a sun freak for that summer. That summer, I was a little overboard. I've calmed down
and
since then.
justifiably so.
Yeah.
So I obviously great news, the second conversation, but when you first heard you had cancer, how was the demeanor of that doctor? Was it like very no nonsense? Because off air, you were telling me that you were like, it was like, you're doing this, right? Was her take. I'm going to schedule an appointment for you and you're going to go. So
Yeah.
tell me a little bit about that. So, hi, Liz, this is Dr. So-and-so. I have your biopsy results. Was it like, are you sitting down? Was it like, is somebody with you? Like, how did that conversation go?
No, nothing like that. In fact, if anything, I was thinking in the back of my mind how dangerous it was. I was driving and
Wow. Mm-hmm.
and she said it was exactly like you said, hi, this is doctor, I forget her name, and we got your biopsy results. Now, I need to tell you, it came back positive for melanoma. This is a fast-moving cancer. So what I need you to do, we're going to set you up, and it's too large for a Mohs surgery, so we can't do it here in our office. It needs to be removed as soon as possible. We're going to make an appointment with a surgeon for you. I know that you're busy and you work full-time. I was an executive at a finance company at that time. And I think she knew that. And so whatever is on your calendar, you need to change it. Like, I will let you know when this is. And so I got to the office, and the first thing I did, of course, was, well, after that phone call, I called my husband, called my mother, freaking out. And we started doing all the research. In fact, the fun story about my mom is I called my mother. She was literally on a plane, boarding a plane to go to China to visit my dad, who was on this long-term assignment, when she heard that I had melanoma and that, some point in the next week I would have surgery. She turned to the stewardess and said, I need to get off the plane. And this is after 9/11, where, it was, once you're on the plane, they don't let you off. And I don't know what she did or said, but she got off the plane. And so she stayed with us, and it was unbelievable. Like, I think about that all the time, that having her around, especially that weekend when we were waiting for the biopsy results, that weekend was really tense. But the beauty is my mom was there constantly, and the kids are just little babies. They're little need machines. They don't understand what's going on.
Right.
And I do think that, like, the everydayness of baths and books and stories and snacks, like all of the little kid stuff, was wonderful, because it was a distraction from obsessing over what if.
The diagnosis.
And I
Right.
do think, like, there's something lovely about that whole 4-day process, is that there wasn't as much, it was as much time spent on the operational challenges of doctor's appointments, rearranging my business schedule, rearranging my work and my staff to cover things that I wasn't going to be there for the following week. Like just all of the operational challenges, childcare, all of those things sucked up all of the air in the room such that it was a blur. Like I remember the phone call and I remember waking up from surgery, and that time in between is just sort of like when you see a cartoon and it's like,
Yeah.
and you see like the whoosh sounds,
Right.
like that's how it was in my head. It just went so fast because when you go from you have cancer on Tuesday to surgery on Friday, um, as you can imagine, and when I'm when you're two working parents, it just gets complicated, really
Right.
fast.
Right.
So
Right.
the
So
operational
too,
challenges of being out for the count post-surgery were as time consuming, right, as the obsessing over. And don't get me wrong, I spent plenty of time on Google
obsessing.
searching
Yeah. Yeah.
for all this
Yeah.
stuff. And that helped. And that, my process is I like to know, I like to understand. I think that there are two different kinds of patients out there. You tell me, you're the doctor, but I think there's one kind of patient that wants to understand and participate in their healthcare management, and there's one that just wants to be told what to do. And I am the former. I don't like being told what to do. I want to. It's my team. I am a member of this team, right? Like I'm not looking for a dictator. I want,
Right.
I want a partner.
Right.
And I think that during this first cancer, I didn't understand those differences. And it wasn't till I got to my next cancer that I did, if that makes sense. This one just went by so
Perfect.
fast.
You said so many important things there, Liz. So you're right. Exactly. There are two different kinds of patients. But in my experience, nowadays,
Mhm.
it's much more the former, and
Yeah.
very few patients are like of that. Just tell me what to do. I think there is something about efficiency in a healthcare plan that's really, really important. So, uh, I hate it when doctors say to patients, like, what do you want to do? Like, what do you think? Well,
Yeah.
I'm sorry. I am not a doctor. That's why I have
Right.
you.
Yes.
Right. So nobody really wants that. But also most of my patients at least don't appreciate here's what you're going to do and go do it. So it sounds to me like this first conversation, when you got the melanoma diagnosis, like you got efficiency for sure.
Yes.
You got, you very much understood, the gravity of the situation. Like you cannot mess around with this. You need to do it now. You got a very clear plan of care. There wasn't like, maybe you could do this or maybe you could do that. But you also didn't get any, it doesn't sound like you had any opportunity for, conversation, like back and forth. And doesn't sound at all like you got any like, hey, you're going to be okay, but here's what we have to do.
I did not get that at all. I got this is a fast moving cancer. The most important thing is to get it out as soon as possible. After it's out, we can talk about what comes next. It was that whole week was just about get it out as fast as possible. And so make sure that you got through all the pre-op, everything, all the, insurance authorization. I mean, all of that stuff had to be done as soon as possible to cut it out as soon as humanly possible. Waiting was not an option. And that was the message that I got. Afterwards, it was actually what I thought was so crazy is after all of this intense, get it out, it's so important. Once it was out and it hadn't spread, there was nothing. Like, okay, fine, go back to normal. Well, how does one go back to normal after being told, oh, well, you might die, but you might not. So, that was really, really hard. I never really got over that because 11 months later, I was diagnosed with my second cancer.
Oh my God. All right. So tell me about that. So less than a year later.
Less than a year later, I went in. So my mom is a breast cancer survivor. And so I started doing mammograms early. And it was, I think, only my second mammogram went in and they saw something a little bit weird and I had to go back for a biopsy. So when you go for a breast biopsy, everyone's feeling your boobs. Like I'm so used to this now, but in the moment it's a little awkward. And the breast surgeon her fingers are, all on my boobs. And then they start scrolling up to my neck and she starts feeling around my neck and she's like, there's something there I don't like. So at that time it was a 2-for-1. I had 2 biopsies that day, one in the breast and one in my thyroid. And it turns out the breast biopsy at that time was a nothing. It was, abnormal cells, like something, nothing to worry about. But in the neck, it was thyroid cancer. And I presented with absolutely no side effects. Like I had no reason to have thyroid cancer. And so I thought, oh gosh, okay, well, it's Wednesday. Do I have surgery Friday? Right. And I learned very quickly that thyroid is a very slow growing cancer, that you have a lot of options. They want you to do a bunch of labs ahead of time. My surgery didn't even get scheduled for 2 months until after that. And so the idea, that was very stressful to me at the time because of all the rush of the last one, being told there's no big deal. Eventually we'll get to it. Hang tight. Was very unsettling. Like this idea that I was walking around with cancer and nobody was doing anything about it was very stressful to me. But it was a gift because it gave me time to plan. And so then it wasn't like this crazy, reckless, I'm out of the office with no plan. It's like I had time and I could work it out. And we rearranged my son's birthday party and, all this stuff that was, we could organize. And I think, again, in retrospect, it was a gift. It was a gift that I had all that extra time to get organized and planned. The downside is it ended for something that was supposed to be a really standard, super easy surgery. I think that 20% of women over 30 get thyroid cancer. Like it's super, super common. You have to keep me honest on that number, but it's like,
I don't know that statistic, but it doesn't sound that far off to me, honestly.
Yeah.
So go ahead. But the post-op was not.
I fell into this teeny tiny category. It's a side effect that I wasn't even aware of because I don't think anyone even warned me about it because it happens to 2% of patients. And I became what's called hypoparathyroid. As a result,
they took your parathyroids out and you got low calcium.
They didn't. So they took the thyroid out and then they even checked because ultimately what happened is I became hypoparathyroid. There were no parathyroid glands in the dissection. In fact, that was one of the things the surgeon was so worried that he had nicked my parathyroid gland and he caused it. And there was absolutely nothing. I think they just were sensitive and got breathed on wrong. I don't really know. But whatever the case is, they released me from the hospital and I was having a little bit of signs of hypoparathyroidism. Like, my lips were a little numb, my fingers were a little bit numb, but they said that's pretty common. I got home.
Wait, pause for 1 second, Liz, because I think this is really important to just bring people up to speed who may not understand the whole parathyroid thing. So everybody knows about their thyroid, lives in your neck. It controls lots of things, including your metabolism, temperature regulation. It's important, not life or death important, like you can supplement thyroid hormones and you'll be okay, but it's important. Geographically, the parathyroid glands, they're called parathyroid simply because they live embedded in or very close to the thyroid gland. And so it is not uncommon for, when someone has their entire thyroid removed, for the parathyroid glands to either come out with them, or be kind of shocked by the disruption in the environment or be injured. The issue is they regulate your calcium levels, and low calcium can have a lot of very, very serious medical consequences. Side effects that I'm sure you're going to tell us about, Liz, but they also affect your heart rhythms and your muscles and so many things. So this is a big deal. So you go home, you're not aware that anything is wrong with your parathyroids. And what happens?
No, if anything, it was like the worst night ever in the hospital. It was a shared room and I had this terrible roommate she was in a lot of pain and constantly complaining and people coming in and out. And and I actually asked for earplugs so I could sleep. It was just, I couldn't wait to get out of there. It was, I felt fine other than just a little bit of this numbness, which they said was normal and that eventually would recover. Well, I got home and a couple hours later, the numbness was traveling up my hands and through my face. And so I called and I said, this numbness is getting more extreme. Is this normal? And I explained it, and they said, get to the ER immediately. We'll meet you there. And they had to put me on IV calcium. Now, it's so rare. It's not like any ER has a bag of calcium sitting around waiting for an IV. So there was literally a nurse standing there with a syringe, and she was the human IV bag until they could get one set. And so I ended up on IV calcium for a week while they tried to figure out how to regulate my calcium without a parathyroid gland. And so because, the way that I think about this is synthroid, because thyroid cancer is so common, the synthetic thyroid hormone, or Synthroid is the medication. I think I've read this, that in lab studies, they sometimes can't even tell the difference between synthetic thyroid hormone and regular thyroid hormone. It's so good. It's such a good alternative
molecule. Yep.
But the hypoparathyroid, there is no great alternative for that because it's so rare. It's not well studied. There's not a lot of money in pharmaceuticals, to, create drugs for it. And so it was a huge amount of trial and error. And like the worst night ever in the hospital was when, there were multiple things that were terrible. One was they put me in the heart unit. But again, hypoparathyroidism, super rare. The nursing staff wasn't familiar with it. I felt myself going into hypocalcemic shock. And I could feel it traveling up my arms. I told the nurse, and she said, well, your doctor's in surgery. He'll be out in a couple hours. I'll call him then. And I was like, are you sure about that? And then I was to the point where my hands were inoperable. My face was all stuck. I'm like using my wrist to hit the nurse's thing until finally someone else came in and said, this isn't normal. And they called the doctor out of surgery. And later I heard him yelling at her in the hallway about, she went in trouble.
Because she didn't give it the attention that it deserved, obviously.
He said, if anything changes, pull me out of surgery. Things were changing. She was uncomfortable pulling him out of surgery. Whatever, I'm fine. I'm here. But it was terrible. And so I went into hypocalcemic shock a lot. That process was, I started to learn the early trigger factors, knowing when I needed more calcium. And the minute that I could feel it traveling my fingers, they would shoot up more calcium and eventually it would go away. But being connected to an IV calcium is not sustainable. You got to get off of that. And so they found a drug called calcitriol, which is a vitamin D derivative that helped in really large doses, along with large doses of calcium and taking Tums all the time, got me weaned off of the IV calcium to the point where they felt like I was, they could send me home safely. And that was 10 days. That was a long time to be in the hospital. It was a really, really long time.
So in the course of that, tell me about, did you have any good or bad conversations in that? Obviously the nurse blowing you off was not good.
That threw me for a loop. That whole process, I was supposed to do radioactive iodine treatment as a result of, after the thyroidectomy. And now I learned I'm asking about every single possible side effect known to man, because if I fall into these teeny little categories, I'm terrified, of anything else. And I said, what are my odds of recurrence? Well, your odds of thyroid cancer coming back are about 2%. What are the odds of any side effects coming from radioactive iodine treatment? Well, that's about 5%. And I was like, peace out. I'm not doing it. I'm just not.
It's simple math.
Oh my God. 2 is lower than 5. I will live with that. What are some other things we can do? And so I signed up for quarterly blood tests instead of annual blood tests, which to me is no big deal. And to me, this is where I started to learn to take better control of saying, okay, well, I'm not going to do this treatment because I'm terrified of the side effects. And I also really didn't like this idea that I would be personally radioactive for some unknown period of time. And I had 2 littles at home, my kids were at this point 2 and 4. And I hated that whole idea. So I walked out, I refused treatment on that. And at the time, even my surgeon didn't even fight me on it. He said, I understand. And I think that that's a reasonable result. The catch became trying to get my meds normalized, because now I need to not just treat my lack of thyroid, right? I need to treat my lack of parathyroid glands.
Mm-hmm.
And getting this synthetic thyroid and um, parathyroid gland meds to work together to keep me normal took a year. And in that year, I was suffering terribly from clinical fatigue. And at the time, it's really hard to know what's normal tired and what's clinical fatigue tired, right? You've gone through babies not sleeping through the night. And I thought, I wasn't this tired when my kids weren't sleeping through the night. Something is medically wrong with me. And I went to my endocrinologist at the time, and I explained that to him. I'm like, this doesn't feel right. And he said, you're a working mom. Working moms are always tired. And he blew me off. And I thought, I am telling you through my words that this is not normal tired. Like, this feels like I feel like there's a weight on my back. I can't move as fast. My eyes are droopy. Like, something is wrong. And he's like, well, your labs look great. See you in 3 months. And I just thought, this is not how this should go. And in the back of my head, I thought, all right, dude, you're fired. But I didn't say that out loud. I wasn't that brave. I am. But when they asked me if I wanted to make a follow-up appointment on my way out, and I said, no, I'll give you a call. Like, just, I needed to leave. And I started looking for alternative endocrinologists in the area. And lo and behold, it turns out that getting into, and so I asked for lots of referrals. Again, you learn, okay, so I got to find out. I don't just go to the endocrinologist that I got assigned to as a result of this surgery. You actually ask around and you get feedback from other people. And I got feedback, and boy, did I hear that there was one particular endocrinologist who is the best in Kansas City. So I'm like, great. Pick up the phone. They're like, great. We can make you an appointment in 12 months.
Oh my God.
I was like, well, that sucks. All right, put me on your wait list. And in the meantime, I need to figure something else out. And so a girlfriend of mine, this is like where I started to learn this kind of balance between Western medicine and Eastern medicine, right? I 100% Western medicine, right? I'm not walking away from like synthetic thyroid hormones and all this stuff, but at the same time, I have all these side effects. Something has to get better. And so and so my girlfriend at the time was telling me about this MD. She was an MD, but had a med spa. And she mostly helped women with weight loss and other kinds of things, but she also did Botox, and she was experimenting with Botox for people with migraines. And it was such an interesting, and again, this was like 15 years ago. And at the time it was cutting edge. I think it's more common now where
Very common.
Yeah.
Very common.
But she was one of the first people, at least in our area in Kansas City, that was doing it. And so my friend Jenny said, go see her. She's like this alt queen. You can complain to her about the fatigue, see what she has to say, like, can't hurt. So I went to her and she looked at my labs and said, everything you're complaining about to me is very consistent with what I see with celiac patients. Why don't you just try quitting gluten and see what happens? And I quit gluten, and 3 weeks later, I felt like I woke up. And I thought, this is crazy. Like, how hard if had for months I was suffering, giving up bread and cookies was such a good trade, right? For feeling good again. And so by the time I got in to see Dr. Hamburg, I was feeling fine, but then I was with a really good doctor who listened to me and didn't just look at the labs. And I think that's also been like just this kind of learning. Like, I understand endocrinologists kind of are more scientists, right? And that they're looking at all these different labs and factors, but that you can't just go by the labs. I remember when I was in the hospital, them being befuddled because I was within what was considered to be normal range of calcium, but they could see me going into hypocalcemic shock. So for whatever reason, my body just needs more calcium than somebody else's. I don't know why. And he was one of those doctors that really balanced those things. And he has said all along that I'm probably one of his healthiest and hypoparathyroid. I mean, first of all, he doesn't have very many parathyroid patients because it's rare, but of those he has, I'm one of the most healthy. And so I really do think it's because of, it's about a lot of those factors that I don't just take the meds. I also, I also dropped The gluten,
Gluten.
which for me was really critical. So
Wow. So, the thyroid it's the condition, I think, where patients have the most frustration, in my experience, in 20 plus years of practicing medicine, when it comes to this lab report thing, right? Like, and I've had episodes on this podcast specifically dedicated to hypothyroid patients who feel horrible but have normal labs.
And that makes me feel so much better.
It is such a travesty in medicine because no other industry does that. Like if you go to a hotel and you're like, you know what, my room doesn't smell good, right? And somebody goes in there like, no, your room smells fine. You're like, yeah, but I'm the guest and I'm telling you, this room doesn't smell good. Chances are, if you're in a decent place, they're going to just move you, right? They're not going to be like, have this fight with you about like, no, the room, objectively smells good. So I think we just have to, and I say this exact thing over and over again in my practice to people I'm training and on this podcast. Like, we are not in the business of treating a lab report. We're in the business of treating human beings. So if the human being is telling you, I don't feel good, you cannot hold up a piece of paper as, the Holy Grail. Like, no, your piece of paper is fine. So it sounds like,
amen, sister. I will tell you, I wish more. I've learned through this whole process to find doctors that look at the piece of paper as a component, right, of the treatment. Exactly. Well, the lab doesn't say that, but if you're complaining, then let's try this. I've heard that. Those are the doctors. And I definitely have met with doctors who said, well, the lab says this. So
it's all right. So two very different endocrinology conversations. And then I do want to get to at least one of your breast cancer diagnoses.
Yes. Okay.
Tell me an important story about that.
Quickly go through very quickly. This is, again, it's all a learning, right? So now I learned to advocate, after these first two back-to-back cancers, I learned to advocate for myself. I learned that there's a real difference, that all endocrinologists, right, are not built equal, which also went to, all doctors aren't built equal. Like this whole idea that there's a certain amount of art and science that goes into medical practice was a big aha. Like that, blew my mind. And that learning took me to the basal cell cancer. So that, again, not life-threatening. It was on my nose. The first plastic surgeon that I went to look at, again, it was just big enough that they had to do a bigger surgery. And it became this really tricky question as to how much of the nose skin could you take off. And then normally I think that they would take a chunk of skin from your neck and use that to cover up what was taken off. But you can't see in this. You have good lighting, but I have a lot of freckles and I couldn't have a freckle pattern. You can't match the freckle pattern from my neck to my nose. I would look like I have a patch on my face. And so then the question became, how do you rearrange the skin to cover the missing skin? And so the first plastic surgeon that I went to said, well, we're going to create a line from the inside of your eye, and we're going to follow it all along your cheekbone down to your jawline. And then that is what's going to give us the amount of movement to cover the nose skin. And then you'll have this giant C-shaped scar on your face. And I was like, he's like, when do you want to book your surgery? And I was like, let me think about it. And I just didn't. So again, had I not had the prior experiences, I might not have known, maybe we should talk to someone else and just see what else is out there. It's not fast growing. It's not melanoma. I have the beauty of time here. So let's just figure it out. And so I went and talked to a bunch of different. So then, of course, you employ the social network of, tell me who the best plastic surgeon in Kansas City is and who's good with faces. Right. That's what I want. And I got the great name. He had this bananas procedure where it's a 2-part procedure. The first one, which I was awake for, don't recommend, where they remove the surgery. They remove the cancerous part of the skin on my nose. And then when you got a Thanksgiving turkey and you're shoving the herbs in between the skin.
The skin and so
I was
muscle,
awake while they stretched the skin over my cheekbones. This obviously didn't hurt. I mean, I was numb, but I didn't like being awake for that. And then I had walked around with a patch on my face for 10 days and then came back. And at that point, the skin was loose enough that they could then cover it back up. And that the scar is very, very faint. You really can't see it to this day. Like I can cover it with concealer and it's gone.
Wow.
And so that was a far more complex and certainly far more painful probably than the prior surgery, but I was all in, right? Because this was the one that was going to give me, a mostly scar-free face. And that's at age 35. I didn't want to walk around with a giant scar on my face. Like who would? No one wants a scar on their face that large. And I thought, this is bananas. Like who would not if you don't learn to advocate for yourself and just ask questions and see are there any other options, no one's going to give them to you. Like you have to ask, you have to learn to advocate for yourself. And so that was really the big aha, like that. I was so proud of myself for that process. It was more of a nuisance than a medical scary moment, if that makes sense.
Right. Yeah.
Because I was just more calm about it. I had done my homework. I found a doctor I liked. All of those things make such a difference, and I think in making and helping to recover quickly, if that makes sense.
Oh, completely. So you had two different plastic surgery opinions. So the first doctor didn't necessarily tell you anything wrong. That procedure would have taken care of the problem.
Correct.
Basal cell cancer would have been gone.
Yes.
But it sounds like he was not very sensitive to the idea of this being on your face, that you're young and you're fair and that scarring matters. So he had the science piece, right? But maybe not the art piece. And then when you had the procedure, I mean, obviously,
and I imagine so this is me being very cynical. And because that particular practice was huge. There was just really, they have their own building. It's huge. They have a gazillion doctors. And my takeaway was that that procedure that would leave me scarred was the most efficient, that would be a very fast surgery. He could knock out multiple of those in a day, as opposed to the much more complex, delicate two-part surgery. I would be willing to bet that insurance probably pays them the same for surgery taking probably 6 times longer than the other guy's surgery. And that piece of our American healthcare system, I think, is, to me, what is so problematic. That and I can understand a doctor wanting to knock out as many as he can. Giving him the benefit of the doubt, it allows him to help the most number of patients, but it's also the most profitable. And I really, that was very frustrating to me. Again, no one said that to me out loud. I think that's me putting a lot of different things together. But that was my takeaway. And that really disgusted me and made me want to not work with him. I'm much more interested in working with medical practitioners. Look, I want my doctors to make good money, right? I want them to be comfortable. They should be supported. You go through a ton of training to do what you do, right? So please understand, this is not like a diatribe on doctors should make less money. But at the same time, I want to work with a doctor that will prioritize my health over the incremental revenue,
Right.
And that piece of it really just bugged me.
Didn't sit well. Sit well. But then you have that perspective also going into breast cancer.
Yeah. The first breast cancer was the ductal carcinoma in situ. It was on my left breast. It was stage 0. I was at that point, because it was my 4th cancer, I might have been more freaked out by getting diagnosed with breast cancer at age 45. Had I not had the prior cancers, but because I'd had the prior cancers, I learned, right? And so I, in fact, went to I met with multiple radiation oncologists. One of them, we talk about the numbers guy versus the not numbers person. The numbers guy was like, we were talking about the, post radiation. Then he wanted to see me on tamoxifen for 10 years at this particularly high dose. And I said, well, I've heard that's going to put me into menopause and that there's all these terrible side effects. And he said, none of those are really real. They're not medically blah, blah, blah. Like he just completely blew me off. And I was like, really? So you're going to tell me that, like, I mean, I've known women on tamoxifen, and I've known that they've struggled with their weight. They've struggled with emotional, instability. I know that they struggle with all these things, with hot flashes, with going into menopause. And you're just going to just straight up and tell me the only thing that is, that scientifically proven is the hot flashes. That's the only thing you'll treat. Like, F off, dude. Like, that's just not. And then I met with a different radiation oncologist, and I asked her a lot of questions because ultimately I wanted to know about outcomes. I said, and one of the things that I learned through this whole process was I wanted to know, what are my odds of recurrence? And has your study looked at women under 50? Because at the time I was 45 years old, and I don't want to look at studies that include 80-year-olds. Like, that does not, I think that we should be looking specifically at women that are better comps to me. And she said, that's a good question, and let me go look at it. And she was so excited by my engagement and would bring me studies and explain them to me and made copies that I could read them, and she acted like a partner. And that was what I needed. Probably would have done the same course of radiation with either doctor, but I did so with such a better attitude and frame of mind, right? Knowing that I had chosen it, that it was going to reduce my odds of recurrence by whatever it was. I don't remember anymore. Like, I felt good about the decision, and feeling good about the decision for me was really critical, which takes me to then my fifth cancer, second breast cancer. And that was, I have invasive ductal carcinoma on my right breast, and I really wanted a lumpectomy. I did not want a mastectomy. And there was I won't go through all the various puts and takes, but my original breast surgeon really pushed for me to do a double mastectomy, and I did not want to lose both my breasts after I'd only done lumpectomy on the left breast. I really wanted to keep my breasts. And so I went through lots of incremental extra tests to see, was it super necessary to take the whole breast? And it was. And so I was at peace with it. Had I done the mastectomy without doing that incremental test, I know myself well enough to know that I would have wondered all along, was it super necessary?
Was it really necessary?
Did I really have to do it? And so I was, and then when they took it, they even found more cancer in there than they originally found in the biopsies, which it put me at peace, right? That I lost it, but it was for good reason. It was riddled with tumors. That thing had to go. And so again, you just learn, right? And so I ended up changing doctors I got 3 different opinions. Two in Kansas City, one at MD Anderson. MD Anderson and KU Med both said, nope, single mastectomy is fine. It does not make any difference whatsoever to your outcome. And I liked those answers better. So I went with those. And I also went with a younger oncologist who acknowledged how difficult estrogen suppression therapy is, and talked about all the different ways that they would help counteract it, and that they weren't going to gaslight me on tamoxifen side effects. And that has made all the difference, again. So you learn to advocate for yourself. You learn to ask good questions, learning to understand odds of recurrence versus. So for example, I think that it was one of those things that after my first breast cancer, they said, okay, tamoxifen reduces your odds of recurrence by 50%. Well, that sounds like a lot, but what are my actual odds of recurrence? 15%. So it goes from 15 to 7. Well, that's a really different number than 50, right? Yeah, and so I think that, again, just trying to understand the statistics of all these different numbers, it's really subjective. For some women, that 15% is too high, and for some women, 15% is reasonable. But it should be my decision. I'm the patient, right?
Yes.
And I think that those are the kinds of things that I have found the doctors that I've chosen to work with are so open and interested in having those conversations with me, as opposed to those that just want to crank through, or have a really strong point of view and don't really want to entertain any other alternatives. So,
right. So, I mean, those are such good points. So, everybody who comes on this show says advocate for yourself, but I think there's some very, specific ways to do that. Yes. And one way is to, understand the numbers, understand the data. And not every patient, and honestly, not every doctor has a head for that. But when the disease process we're talking about is so dependent on statistics, like you got to dig into the numbers. And like you said, like it's a way, if you're telling me my risk of side effects is 10%, my risk of recurrence is 2%, like that's not good math in favor of the treatment, right?
Right.
And then
and
the
again,
other
there's
thing,
some people that living with that 2% recurrence is
too much.
too stressful and they
Yeah.
want the treatment, which is
Yeah.
great. Then they've made the right choice for them. That
Right.
And I
But
think
it should be their choice.
it's their choice. It's not the doctor's choice, at least from my point of view.
And then the other thing I think I get from your story too, Liz, is the like take a breath and get more opinions approach.
Yes.
You know, like
Yes.
when it's medically feasible to do so. I think a lot of times when patients get a scary diagnosis, like our instinct is, oh, let me just tell me what to do right now. I just got to get it done right now. Like I want this over. I want to put this behind me. And you know, sometimes that's what you have to do, kind of like with your melanoma, like probably getting that surgery ASAP was important. But in other situations, like your basal cell or your thyroid cancer, or even your stage 0 breast cancer, like you have a little bit of time to get
even with
a couple of opinions.
IDC, the first question I asked was, okay, what is my deadline? How much time do I have to make a decision? And she gave me a date and I stuck with it. And so she gave me 12 weeks, which
was enough.
And that gave me the time to decide. And so I knew, and I think that's the other piece too. Like to me, if you would talk about advocating for yourself, to me, one of the best questions to ask is, okay, when do I need to make a decision by? And if you have a date, then you know, okay, I'm going to live with this uncertainty for this amount of time. And when you know that there's an end to the uncertainty and that uncertainty has an end date, I think it's much more easy to manage. Living with uncertainty is one of the absolute hardest parts of cancer. And even then, I mean, don't get me wrong, I held my breath until my oncotype score came back 3 weeks after my invasive ductal carcinoma, because I would have determined whether I had to do chemo or not. And I was, we popped a very expensive bottle of champagne when that oncotype came in at 13, below the number 20, which was like the go, no go number. So that was, waiting for that was also really hard, not knowing exactly when that was going to come in. But again, I still think that living with uncertainty is one of the hardest things for cancer patients in full stop. And yet, I think that if you ask the question once you're diagnosed, okay, give me a deadline for when I have to make a decision on my treatment plan. I think most doctors will give you a deadline.
Absolutely.
Right? And say, okay, well, I think you can take about 3 weeks, or okay, you can take 2 weeks, or,
right.
Or in the case of melanoma, you have no time. Like, okay, then I have no time.
Then this is what I have to do. Yeah. Right. So, I think just to close, I think a couple of things. One is, I love the deadline idea. And the other thing about second opinions, though, is second opinions, maybe third opinions. But when people get into like fourth, fifth, sixth, just this never ending list of my husband has this thing he does where if he's making a purchase, and it doesn't matter what the purchase is, it could be like a $2 thing, or it could be like a house. He will perseverate about the choices for so long. And the more choices, the worse it is. So actually, my family has coined this phrase. We've made a verb out of the word briefcase. So he briefcases, because he did this thing with purchasing a briefcase. Like he stood in front of, not literally, but figuratively, like, a wall full of choices of briefcases, and just could not make a decision. One, because he didn't have a deadline. Like that briefcase was not necessary for tomorrow. And two, he had way too many choices. So I think if you're going to briefcase your second opinions, I think knowing this is my time frame, and also here's choice 1, 2, 3, and you've already collated them, curated them based on all of these opinions. So that's enough. And I would say, medically speaking, truly, I think 3 really high quality opinions when it comes to almost any diagnosis is plenty. When you get outside of that, then it's just too many, and it makes it much, much harder to make a choice. So,
And you know what I'm going to throw at you also to add to all of that is quality opinions,
yeah,
because
totally.
Facebook groups are not quality opinions.
Yes, absolutely.
Or your Aunt
Absolutely.
Marge's bad experience with her knee surgery, right? I mean, so those are the things where that's the other trick, I think, is learning what to listen to and what to screen out. And I've
Yes.
gotten better at it. But when you're a first time cancer patient, that's overwhelming. And I do think that
Right.
that is really, really hard. But I love this. Three to me was perfect. Once I
Mhm.
got that third opinion, I was at peace with it.
Right.
Um,
And it is
I,
also
yeah,
important to make sure it's an odd number, right? Because I think when you have
yes.
three, like in your case, two recommended, not double mastectomy, one was recommended double mastectomy. So you kind of have a tiebreaker in there, which makes it a little bit easier. Like when you get two opinions and one says this and one says that, like, oh, like, how do you know? So really great stuff, Liz. First of all, I'm so glad that you're okay after everything you've been through.
Thank you.
Can
I'm
I ask
fine.
you, how old are you now?
I'm 50.
So you're 50. You and I are about the same age. And how old are your kids?
My daughter is 18 and my son is 15.
Wow. So your kids grew up in your journey from the
Yes.
very beginning. They've
It's a part
watched.
of their childhood is a mom that's been
Yeah.
sick. My daughter
Well,
wrote a beautiful, like, made me cry essay about it for her college exams. Do you hear that, University of Virginia? We're still waiting.
oh my God, plug. Absolutely. Wow. So I think that's a nice thing to end our episode on before I get to the other thing I actually want
Okay.
to end on. When you're a mom and you're going through stuff, whether it's healthcare stuff like this or just other things, trials and tribulations of life. I mean, our choices that we make and our approach to these things influence our kids and how they approach these things and how they handle them. So I think you grew up, you started out one kind of patient, and by force, you became a different kind of patient. But your
Mm-hmm.
kids now have that whole perspective. So,
Mm-hmm.
as a mom, I want my kids to struggle less than I do in every which way. So if your kids can make, informed, well thought out decisions for their own healthcare, you've won as a mom. Your struggle isn't just
Oh,
about you,
I
right?
feel like I mean, because I'm still here and I'm healthy and fine, I can say, so again, caveat, 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 that I think that there have been more positives than negatives, that my
Mm,
kids have learned, that they've learned empathy through all of this, that the world continues to turn when your family's in crisis. And
mm,
I think it's made them more empathetic. So like if they have like a friend or a colleague or whatever, or a teammate, that is having a bad day, they, I think, intuit maybe something's going on that I can't see because they have
right.
had that experience.
Mm-hmm.
So I think that that's amazing. I think they've both learned a lot more independence. Like they started doing their own laundry and helping make dinner a whole lot younger than I ever did.
Right.
And and seeing and understanding that they needed to help with the family dynamic. Like when I was having some kind of side effect. I was very ill after one of my radiation bouts, and my daughter just picked up a spatula and made pancakes for dinner. Like didn't ask,
Oh.
just did it. And like
Mm-hmm.
those little things, are just amazing. And I think that's making them better humans, I hope,
Oh,
And
absolutely it
so I think
is.
that that's a good lesson to learn, right? Like you said, like you don't want them to struggle. I wouldn't sign them up for this struggle. But one of the
Mm-hmm.
benefits, right, is that they learned empathy, they learned self-reliance, they learned self-sufficiency. And I think also they learned resilience,
Mm.
that they see me, and my son talks about this all the time, and they see how, you can get kicked down and you take a minute and then you get back up, like that.
Mm-hmm.
And things that you learn through sports and other ways too. But cancer can provide the same kind of gift, right? And if you at
Absolutely.
least accept it. And so I think that that has
Mm.
been a big part of our family dynamic.
Very positive outlook to take. And so you mentioned side effects of radiation. And I think that's a
Yeah.
really great segue because I want to leave our listeners with, uh, your business. So as a result
Yeah.
of your treatment, you launched a business. Tell me about what you do, and who you do it for, and how people can
Yes.
learn more.
So, working backwards in 2017, I was really struggling with radiation. It's one of those treatments that people don't pay a lot of attention to because chemo is worse, right? And I'll acknowledge, yes, chemo is worse. But I really struggled and I was burned and tired and fatigued and looking for all the stuff that you need to kind of monkey through treatment that are not the things that are, doctors can write prescriptions, but there's all sorts of stuff that you need that is non-prescription. Ice packs, lotion, lip balms, right? All those things. And so I thought, where is radiationrelief.com? It didn't exist. And so I wrote a survey, and the survey went down two paths. And the first path was for cancer patients to ask what kinds of things, what treatments did they go through, and what kinds of items would they want and need when going through treatment. And then you ask people, if you haven't had cancer, have you bought a gift for a cancer patient in the past 18 months? And if so, what'd you get? And there was this huge disconnect. What people want and need are all functional. The top 5 performing items on our list of like 50 things were lip balm, lotion, ice packs, fleece blankets, essential oils, which I'd never used. The bottom performing items, the things that got 1 out of 5 scores that nobody wants: kicking cancer tote bags, kicking cancer coffee mugs, worry stones, inspirational poetry, right? Those things all got the worst scores. And then you ask people what they're buying, and it's mostly flowers and food and t-shirts, right? And I thought, okay, we can do better. And so I wrote a business plan during the pandemic, because what else am I going to do? And and I launched a business, and it's gone through a couple different iterations. It's called thebalmbox.com. It's BALMBOX. So thebalmbox.com. So balm, like soothing. And it's functional care packages for cancer patients. So we have a whole breast cancer section, chemo, radiation, just launched some men's care packages, and it's all data driven. I'm a big believer in data. That survey that I mentioned, because it was over the pandemic, it went viral and collected almost over 500 responses, which was amazing. Wow. And so statistically relevant tells you that people want functional things. And so our area specialty is functional care packages. I get all emails all the time from various people trying to sell me pink crap to put in our packages, and I say no, it's not our brand, that's not what we do. And the results have been amazing. We are bursting at the seams. We need a new warehouse. And then the other really exciting part is we have part of this whole process. We developed some specialty pillows. So one is a seatbelt protector. So, if you have, whether you have like a chemo port or radiation burns or even surgical scars, that seatbelt is really annoying. Like the pressure of the seatbelt against you hurts. And so we have these really neat seatbelt protectors. They're these just kind of peanut-shaped pillows that the tension of the seatbelt will hold the pillow in place, and it provides just enough distance while still keeping your seatbelt on,
protecting you.
And so those are picked up by CVS.com. And so we sell them wholesale to doctors' offices as well. So that's another one. And then the other is, I love this. It's a side protector pillow. I'm trying to figure out how to get this. And so this is it's like a C shape. I'm trying to figure out how to do this with my, it's not working because
the background's a little tricky.
I know. Yeah. The background here is my not real office. Anyway, it's a C-shaped pillow that here we go. It's a C-shaped pillow that fits under your arm. And so one of the things, especially during breast surgery and even during radiation, the weight of your arm against your side of your breast, that friction hurts. And so having the pillow just scrunch under your arm is awesome. And I actually like this one because the skinny arm then doesn't get in your way, and you have this really thick part in the back, and it helps, especially when you're lying down, to kind of get your arm off of your body. Wow. And I love these, again, also CVS.com, as well as our website and some doctor's offices. So
So I'm going to link to everything in the show notes. So thebalmbox.com for care
Correct.
packages.
Yep.
You've got the seatbelt protector. You've got the C-shaped side pillow.
Side protector. Yeah.
All of these things will be in the show notes. So to everybody listening, please just check out the Balm box. And unfortunately, every single person listening to this podcast knows somebody who has struggled with cancer. And, I am guilty. I have bought so many flowers and so much food and so many, cancer's not going to win stuff. Because, people want to do something, but it is so great to actually know what people want and then do that. It's still doing something. It's just doing something more meaningful. Liz, I can't thank you enough for being here, for sharing your story, for being so brave and so vulnerable. I've learned so much from you. To my listeners, thank you for being here. If you have had a terrible or a great medical conversation, I want to talk to you. Please email me, Christine@ChristineMeyerMD.com. Once again, our guest, Liz Benditt, the website is thebalmbox.com. It'll be in the show notes. Liz, so great to meet you. Thank you again.
Thanks for having me.